Today, I'm going to share with you a topic that many men wonder about, but few talk openly: whether preserving the foreskin or opting for circumcision is healthier, safer, and ultimately the best choice. We'll cut through the noise, myths, and cultural confusion to examine the biology, the medical evidence, and the real-life implications of both sides of this debate. By the end, you'll have insights and clarity, whether you're considering this for yourself, your partner, or your child. If at any point you find this helpful, please hit that like button, share it with a friend who might benefit, and subscribe to the channel so you'll catch future videos on men's health and wellness. And I'd love to hear from you. Drop any questions or your experiences below in the comments. So, let's begin. I'm Dr. Ethan Carver, a board-certified urologist and men's health specialist practicing in Austin, Texas. First, let's understand that the foreskin is a natural part of male anatomy with several functions worth knowing. It acts as a protective cover for the glands, the sensitive head of the penis, maintaining moisture and shielding it from friction and abrasion. Underneath, the skin remains moist and supple, much like the delicate skin around our eyelids or inside the mouth. It contains specialized nerve endings called Meissner's corpuscles, which heighten sensitivity and contribute to pleasurable sensation during intimacy. This isn't conjecture. Studies published in respected urology and histology journals confirm that the foreskin is one of the most richly innervated tissues in the body. Its role is smooth, protective, and sensory. As humans developed tools and techniques like circumcision, this natural protective feature became optional. Circumcision involves surgically removing the foreskin, typically in infancy or childhood. Some cultures and religions see it as hygiene, others view it as tradition, while modern medical communities have studied its potential health benefits, but so much commentary is rooted in ideology or outdated assumptions. My goal is to lift the fog with up-to-date, evidence-based insights. Let's look at the health advantages associated with circumcision. Over the years, several large studies have revealed compelling findings. First, urinary tract infections, especially in infancy, are significantly lower in circumcised boys. The American Academy of Pediatrics reported that risk can be as much as 10 times lower in circumcised infants compared to those with foreskin intact. While UTIs are relatively rare, their consequences in infants can be serious, and prevention does matter. Circumcision also plays a significant role in reducing the risk of certain sexually transmitted infections. Multiple studies, including randomized trials conducted in sub-Saharan Africa, showed that circumcised men had up to a 60% lower risk of acquiring HIV through heterosexual intercourse. The World Health Organization and UNAIDS have even endorsed circumcision as a preventative strategy in high HIV prevalence settings. Beyond HIV, research demonstrates a reduced risk of other infections like HPV and herpes simplex virus among circumcised men. This doesn't mean foreskin equals doom. Safe sex, condoms, and regular screenings are still essential. But circumcision remains an added protective layer for those at higher risk. However, circumcision is not without its drawbacks. It's a surgery, typically performed without anesthesia in neonates or with local anesthesia in older boys and adults, and surgeries, no matter how simple, carry risks. These include bleeding, infection, narrow residual skin, meatal stenosis, and scarring. In skilled hands, complications remain rare, often cited under 1%, but they do occur and should be taken seriously. Adults choosing circumcision may experience discomfort or pain during healing, and healing may take 3 to 6 weeks, which can delay sexual activity and impact quality of life during recovery. Another point of debate is sensitivity loss. Some men report that circumcision reduces penile sensitivity and alters sexual experience. Scientific literature offers conflicting conclusions. While a few studies report measurable changes, others find no significant difference in sexual satisfaction, orgasm frequency, or function. Much of this is subjective. Different men have different thresholds and perceptions. Emotionally, for someone circumcised later in life, there may be an adjustment period as sensitivity patterns shift. In contrast, those circumcised in infancy often adapt without conscious awareness because that's their baseline. While evidence often centers on physical health, we can't ignore cultural, religious, and personal dimensions. In communities where circumcision is customary, among Jewish, Muslim, or many African and Christian households, performing the procedure can be deeply meaningful. Conversely, some advocate for bodily autonomy, arguing the decision be deferred until the person can consent. In Europe, for instance, circumcision rates are relatively low, reflecting divergent cultural norms. In the U.S., about 70% of men are circumcised, though that number is declining and varies by region and ethnicity. Every family's perspective and values play a role. Then there's the matter of medical necessity. In certain conditions, circumcision is not a choice, it's a treatment. Phimosis, where the foreskin cannot retract, can lead to pain, poor hygiene, recurrent infections, or difficulty urinating. Balanitis, or inflammation of the glands, may recur despite conservative treatments like topical steroids. In these cases, doctors can recommend circumcision not as a preference, but as a medical necessity to restore function and comfort. That decision should always follow informed discussion. Parents or patients need to know risks, benefits, and alternatives like topical treatments or preputioplasty, narrowing the foreskin without removing it. Now, let me share a few real patient stories, anonymized naturally, because these scenarios help ground abstract facts in real life. One patient, a 35-year-old man who had chronic balanitis despite topical treatments, chose circumcision after discussing the options. Within 6 weeks, infections were resolved entirely, and he reported not only improved hygiene but also greater confidence during intimacy. Another patient, who grew up uncircumcised and had always wondered if it affected his performance, underwent counseling and decided against surgery well into his 50s. He focused on proper hygiene and safe practices and reported no changes in his sexual satisfaction over the next year. And finally, a young parent asked whether to circumcise their newborn son. After careful review of pros and cons, they opted to wait until their son could participate in the choice later, illustrating how values, timing, and information shape decisions. When weighing which path is best, here's a helpful checklist. First, assess your values and context. Is hygiene concern, disease risk, cultural tradition, or impact on sexual sensation most important to you or your family? Second, evaluate health risk, low for most, but higher in settings with high STI prevalence or poor hygiene. Third, consider timing. Neonatal circumcision is medically simpler and less expensive, but adult circumcision allows for fully informed consent. Fourth, consult a trusted medical professional like a urologist to review anatomy, risks, and personalized recommendations. No matter your decision, proper hygiene and awareness remain critical. For uncircumcised men, gently retracting, once fully retractable, usually after adolescence, cleaning under the foreskin with warm water, and drying carefully can maintain health and deter buildup. For circumcised men, moisturizing the glands with gentle lotion and wearing breathable fabrics helps reduce dryness or irritation. Safe sex practices, condom use, reducing number of partners, and regular STI screenings are essential regardless. At this point, you may wonder, am I advocating for circumcision? Am I dismissing foreskin? The answer is neither. The healthiest choice is the one that aligns with effective hygiene, informed consent, personal values, and, when relevant, medical need. If you choose circumcision after careful evaluation, know that many men do so safely and with satisfaction. If you choose to keep the foreskin, that's also a valid choice rooted in biology and normal development. As a urologist and men's health specialist, my main goal is that you make an informed, confident decision, whether for yourself, your son, or your community. I hope this conversation illuminates both sides with clarity and respect. Please take a moment if this was helpful. Like the video, share it with someone who may benefit, subscribe if you want more scientific, compassionate men's health information, and let me know your experiences or questions in the comments below. You deserve accurate, stigma-free guidance. No matter where you land on this discussion, your body, your health, and your choices are important. This is Dr. Ethan Carver, speaking from Austin, Texas, reminding you that knowledge is power, and good health is within reach. Thank you.